This is Akasha Vani Mangalore. Dear listeners, in today's Talk in English program, Dr. Maheshbabu Pattar, Assistant Professor, Department of Psychology, Sri Dharmasthala Manjunatheshwara College, Ujire, will now speak on the topic Emotional and Behavioral Problems in Adolescents.
Adolescence is a period of emotional sensitivity and self-centeredness. Most young people experience difficult emotions during adolescence. There are some typical emotional changes that can occur during puberty. The mood swings, feeling differently about peer groups, becoming more sensitive to the world. The feeling overly sensitive, feeling self-conscious, and peer pressure. There are some common mental illness in adolescence that includes nowadays many young people they always have a complaint about feeling anxiety, having fear, mood fluctuations, attention and behavioral disorders. And there are other emotional problems that includes depression, anger issue, sadness, eating disorder, disruptive behavior and social disorders. Hormones can also affect adolescents' moods, heighten their emotional responses. These characteristics mean that teens are more easily swayed by emotion and have difficulty in making decisions that adults find inappropriate as well. Some epidemiological studies have shown that 5 to 10% of children and adolescents suffer from emotional and behavioral problems, which are among the most common psychiatric disorders for this age group. Emotional and behavioral problems are associated with suffering and disturbances in the daily life of the affected person. So these problems were associated with an increased risk of substance abuse, depression, and impaired social and emotional functioning during the adolescence. Adolescence is one of the most important periods of life, and in fact, so this stage is considered to be a childhood to adulthood transitions. So this intermediate phase is accompanied by an important physical, psychological, and social changes, in addition to rapid changes in behavioral patterns that affect the performance of an individual during an adulthood. Obviously, a child can copy and can imitate in the later phase. That is the reason every member of the family have an important responsibility to teach a good manner and the good behavior to their younger generation. In adolescence, the basis of many behaviors affecting the health and lifestyle of an individual is formed. Most attitudes and behaviors formed during this period to determine the habits of healthy lifestyle during the adulthood. There are many other reasons which could also affect to the adulthood by peer pressure in terms of habit. By looking at others, they do adopt and they do follow that. There is a famous psychologist as well as psychiatrist called Erikson considered adolescence as a period of identity versus a role confusion. Given that identity is the unit that exists in the three biological, social, and psychological systems, when such unity is not achieved, adolescent relationships and other behavioral patterns are disturbed. Some studies conducted in the 2007, in this study it has been mentioned that 11.9% of adolescents needed a mental health services due to behavioral problems. The most frequent psychiatric disorders in the childhood and adolescence are anxiety disorders, up to 31.9%. Behavioral disorders, which falls under 16.3 to 19.1%, whereas substance disorders has been reported 8.3 to 11.4%, and emotional disorders 3.7 to 14.3%, and aggressive always Antisocial disorders 2.1 to 7.6. Personal problems usually occur when they face a new condition of puberty and identity crisis. The disability of the adolescent in the adapting to the new conditions that leads to the emergence of behavioral problems. The results of several studies have shown that the girl shows their problems as internal behaviors such as isolation, physical symptoms, depression, and anxiety. Some other studies have shown that emotional and psychological problems of adolescents increases with the age. One of the most critical period in women's life is adolescence, which leads to the onset of menstruations. About 70 to 90% of women undergo various physical and mental changes before or after menstruations. Bleeding or its onset, which is called as premenstrual tensions. Actually, emotional imbalances and instability are the most prominent features of adolescence. Sensitivity and emotions caused by irritability. Due to this, there might be some other physical complaints as well, which might show changes in terms of heartbeat and in terms of irritability also, which are the prominent features of this period, are often due to changes in the endocrine system, level of hormonal secretions, and type of education and training of adolescents in the past that totally make up the emotional state of the adolescents. So due to hormonal changes in adolescents have mood swings and frequently change their temperament. They tend to have more intense and wide-ranging emotions than children or adults, and they exaggerate their problems as well. It's common to see adolescents fluctuating between feelings like they are on top of the world one moment and being depressed the next. So these emotional changes affect their school performance, appearance, choices of friends, and their ability to make appropriate life choices. Adolescence is a time of emotional stress in the house as adolescents become increasingly independent and their desires often clash with their parents' requests. Adolescents are inclined to take risks, whereas their parents are interested in their safety. They tend to act impulsively without thinking about the consequences, and they make decisions about on what feels good at the moment. Adolescents often react emotionally without even listening to the reasons. Therefore, behavior issues, the rebellion is common. Adolescents lean toward making intimate relationships with friends while distancing themselves for their family. In addition, their perception of themselves is tied to how others view them. Adolescents may think they are constantly being watched and evaluated, making them overly concerned with their appearance. Although adolescents crave independence from their family, their insecurity and social pressure cause them to strive to fit in with the crowd in order to be accepted. Along with independence and emerging identity, adolescence marked by the beginning of romantic interests. However, sexual emotions induce anxiety, and these underlying emotions often distract adolescents from their day-to-day activities such as schools, sports, and recreational activities. There are some emotional changes during adolescence. All changes in life bring out emotional reactions as all stages of life. Adolescents are able to cope, but adolescents need positive support to cope. The onset of puberty brings physical changes among the adolescents. So these changes are often accompanied by emotional reactions. The adolescent is exposed to a new social situations, patterns of behavior, and societal expectations which bring a sense of insecurity. It has been found that there is an increase in the incidence of a depression. The adolescents show the tendency of impulsive urges to take immediate actions, which often leads to risk-taking behaviors. There are some emotional ability understanding their feelings are impulsiveness, preoccupied with the body image, frequent mood changes and mood swings, self explorations and evaluation of their emotions, confused at times, poor coping skills, succumb to stress and emotions, and daydreaming as well as fantasizing. So these include both positive emotions like love, happiness, joy, as well as negative emotions like sadness, depression, unhappiness, anxiety. In addition, feelings of anger, rebellion, and protest also emerge. Interestingly, emotions of loyalty, patriotism, and sacrifice. For the nations also developing during adolescence, each of the emotions is felt very intensely. Adolescents tend to express everything in exaggerated form. Mood swings also occur quite frequently. Sometimes they're happy, sometimes sad. Sometimes they have high degree of patriotic zeal, but a few minutes later they become disillusioned or angry. So this makes their behavior somewhat unpredictable. A conscious as well as increased interest in about one's own body develops. The body image can also bring a sense of fun, pride, shyness, or even unhappiness and low self esteem. And emotional problems will often affect our college work or any types of work. A pressure to do well and pass exams may come from parents or teachers, but adolescents usually want to do well and will push themselves. There are some body image concerns leading to a slow self esteem, need for acceptance in their peer group, experimentation and risk taking behaviors, smoking, as well as drug abuse, attraction towards the others, and infatuations as well as heartbreakings. So, conflicts with the parents and the family as well as elders, establishing identity and wanting independence, clarifying personal value system, setting goals and career planning, antisocial behaviors, media influences, internet chatting, blogging, Facebook, etc. A 13-year-old Rashmi is very confused. Yesterday was her 8-year-old brother's birthday and she was very excited and wanted to join in the party games. Her mother scolded her. She was too old for them and instead should help her. Her mother's friends came over a party and Rashmi wanted to sit and listen to the juicy gossip. When her mother once again scolded her, she was too young to listen to it. Was she young or old? A child or an adult? So this is the dilemma that all adolescents face, which leads to the identity crisis. Identity or a sense of a sameness and continuity must be searched for it. He or she wants to become independent, but parents are not ready to let go. A girl or a boy finds empathy in his peers, which further estranges him from his parents. He becomes or she becomes touchy and sensitive and irrationally emotional. Adolescents are basically fun-loving, enthusiastic, energetic, daring, and full of life. They are naturally curious and willing to explore a new avenue and experiment in new things. Mood swings are normal part of adolescence, and therefore the emotional and behavioral problems in childhood should be identified and treated as soon as possible.
Emotional and behavioral problems in adolescents. That was a talk delivered by Dr. Maheshbabu Pattar. This talk came to you from the studios of Akasha, Vani, Mangalore.